So welcome everyone, I'm Stephen Huang. Welcome to the Paula Goering Memorial Scholarship winners presentation. I'm going to open us with a land acknowledgement. The 2024 National Conference on Ending Homelessness is being held on the traditional unceded territory of the Anishinaabe Algonquin peoples. The people of the Anishinaabe Algonquin Nation have lived on this territory since time immemorial. Their culture and presence have nurtured and continue to nurture this land. We acknowledge and celebrate the many First Nations, Métis, and Inuit people from coast to coast who participate in this conference and lead the work to end homelessness across Turtle Island. So it's my pleasure to introduce our award winners and their presentations. So we're going to start with Dani Marroquin. She is a program manager at McMan South in Medicine Hat, Alberta. Dani.
Hello, everybody. Thank you, Stephen, for that intro. I'm just going to change this. All right. So as Stephen mentioned, my name is Dani Marroquin. I'm a registered social worker and a programs manager at McMan South, which is an agency in Medicine Hat, Alberta. And today I will be presenting on moving forward reflective practices in permanent supportive housing programs. I wanted to provide my own land acknowledgement as I'm not actually, as you know, from Ottawa area. And so I want to acknowledge that Medicine Hat is situated on the ancestral lands of the Siksika, Kainai, Piikani, Stoney Nakoda, and Tsuut'ina, including the Cree, Sioux, and Saulteaux bands of the Ojibwe peoples. I also want to acknowledge that Medicine Hat resides on the traditional homelands of Métis Nation and District 2. I also want to take a quick opportunity to just acknowledge a couple folks that really inspired my practices to be here today, which include my agency McMan and the Canadian Alliance to End Homelessness for this incredible opportunity, as well as Dr. Paula Goering for just paving the way for housing first practices. My team at PSH, which really I wouldn't be able to have had the same outcomes that you'll see as I did if it weren't for their willingness to participate in such innovative things, I'd like to say. My own personal support team, which is my family, and then the participants that I've had the absolute pleasure of being able to work and grow alongside. All right, so just a brief overview. I'll start off with some introductions on myself and my agency, touch on McMan's permanent supportive housing model, reflective practice and its context in housing first, framework within the PSH program that we utilize currently, and how it's contributed to improved client outcomes and supported us with tackling opiate-related emergencies. I'll also touch on linked advancements and end with some key takeaways and contact information. All right, so a little bit about McMan South. We have been operating in Southern Alberta for since 1975. There are several divisions in Alberta that make up McMan South. So McMan in general. So McMan South is any city south of Calgary, for those of you that are familiar with Alberta. So McMan South definitely covers more rural areas with some larger cities served. For reference, larger city is 63,000 in Southern Alberta, which is what Medicine Hat is. So not super large centers, and again, more rural areas and reserves as well. We have over 30 programs in Southern Alberta that range from supporting children, family, adults in various different capacities. So that includes coaching, one-on-one work, outreach, and all of our programs utilize various different approaches as well. I oversee two programs at McMan South, one of them being the PSH program, and I also oversee an emergency youth shelter. A little bit about myself. I started in the sector in 2017 in the social services sector. Initially started in the disability services field. I actually started at permanent supportive housing as a practicum student in 2019 with no intention of staying in the housing and homelessness sector. So naturally, we can see how that went. Since then, I have went on to do frontline support work, intensive case management, I took a brief hiatus from the agency sometime last year to work in healthcare as a mental health therapist and a program coordinator. And then I came back August of last year where I stepped into the program manager. Sorry, I totally lost my train of thought. Program manager position. Should I just leave that? Oh, okay, great. No, that's okay. All good. And so it's kind of great to be back up here at kind of what feels like full circle. So, so a little bit about our McMan Permanent Supportive Housing Program. Like several other programs, we operate on-site with 30 on-site units for folks who require more intensive 24/7 supports. We are a recovery-oriented PSH program, and we also have capacity for up to 15 scattered site individuals in community through private landlords and other market rentals. As I mentioned, our folks on site are supported 24/7 by support workers, intensive case managers. We have community. We have a lot of collaborations with community where we do clinics on site. We do a lot of community events that are facilitated by our support team, offer daily living support so very similar to other PSH frameworks. For us, for referrals, they come through our main housing body in Medicine Hat, and they're triaged directly to our program where we complete an assessment following that. We have been operating since 2016, and I would say up until about last year, PSH was operating status quo. There weren't really many developments in practice to note, but in August 2023, there was a change in leadership, which included myself and a new program supervisor as well. All right, so reflective practice, really, what is it? It really just involves critically thinking about one's experience, actions, and decisions to enhance future practice. It reminds us to analyze our interactions, biases, and the impact of our work with our clients. A lot of other similar frameworks include the Plan, Do, Study, Act, or PDSA loops, developmental evaluation, and person and environment theory. Early adopters really just thought of it as a way of thinking. So thinking about reflective inquiry, so actively critically thinking, and the ability to change practice in the moment. And they also touched on things like reflection in action versus reflection on action, which again, pretty straightforward. Reflection that can happen in the moment and reflection that happens after the fact, which requires a little more hindsight. As I am a registered social worker, I wanted to do a brief connection to how this practice is also connected to not only Housing First, but the Canadian Association of Social Workers. It's a highly valuable practice as it actually reflects one of our key values, which is valuing human relationships. This just reminds us to, as social workers, to examine our personal beliefs, assumptions, and moral positions, and acknowledge the fact that our practice does have an impact on ourselves and others. It reminds us to seek out supervision, consultation, and mentoring on a regular basis, and also helps keep at forefront that our practices directly contribute to instances of burnout, compassion fatigue, vicarious trauma, and a reminder of self-care as well. So reflective practice and the value of valuing human relationships not only strengthens our well-being, but also our practice. So some key components of reflective practice include self-awareness. So really, again, just understanding your personal beliefs, values, biases, and emotions that can influence your practice, whether that's personal or professional values or beliefs. Critical thinking, so analyzing situations and considering various perspectives other than your own or those around you. Feedback, so again, seeking and integrating your learning from colleagues, clients, and supervisors, all levels of folks that are involved in your practices. And lastly, and the most important, I would say, for reflective practice is absolutely learning from experience. This allows you to assess past interventions to improve future responses. All right. So context in Housing First. So a client-centered approach, really reflective practice, helps us build that empathy and build a deeper understanding of a client's lived experiences, which is really essential, as we know as housing practitioners, to address the complexities of housing and homelessness, and how important it is that we listen to our clients' stories and understand their unique needs. And ensures that housing solutions are actually tailored to the individual circumstances and not what we think might be best practice in the moment or even easiest in the moment. This practice also reminds us, as I mentioned, to address our biases. So confronting our own personal biases about homelessness in general, about our participants in general, which ultimately affects service delivery and how we support our individuals. And it also encourages us to reflect on stereotypes or assumptions about someone's personal responsibility in homelessness as well, which is an effective stance that is aligned with housing principles, housing first principles in general. Absolutely supports problem solving, so helps you evaluate the effectiveness of the tools that you're utilizing in your programs and adopt strategies that are based on what actually works in practice rather than using outdated practices. It supports with policy advocacy and advocacy in general. It reminds us to look at systemic issues beyond just what we're seeing day to day and advocate for more effective housing policies and resources. And I understand that for frontline supports, this can be a little trickier, as we're not often, folks in frontline might not be in a position to advocate for policy level or political level changes, but that's where it's up to us, as if you are in a leadership position, to absolutely bring those to the forefront and bring those to your leaders and your community, because that is how we absolutely make changes in our community for more positive supports. It supports with taking a holistic approach to our practices, so encourages a comprehensive understanding of the social determinants of housing stability. It guides practitioners in providing a more holistic support to individuals and families, and again, encourages us to consider the broader social determinants of health. So this is really crucial. As we know, housing isn't just housing. There's way more to that for housing to be successful. It includes mental health services, addiction services, job training, which is vocational services, and other social services to actually provide long-term stability. With PSH and McMan, I would say by taking a holistic approach, it also has really opened the door for us to be a true ally and work toward Canada's truth and reconciliation efforts as well, while also decolonizing our practices. Next, consistency and evaluation. Again, assessing the effectiveness of our housing interventions and what we're using in practice. We're analyzing what aspects of housing first models work well and where improvements are needed, which is fostering a culture of learning at your organization or within your team. And lastly, building trust. So again, establishing relationships, developing trust and rapport with participants, which is essential for successful engagement, because if you don't have that trust, you know that you won't really get anywhere with your interventions until that relationship is built on mutual trust and respect. And it absolutely allows us to empower the client in utilizing their voice, which is really crucial in shaping their housing journey and outcomes. So ultimately, the synergy between both approaches lead to more effective support for individuals experiencing homelessness. And we just have to think about it in a way of, why do we want to change, and what are the reasons that we want our programs to change? What are the outcomes that we want versus what are the outcomes that are actually necessary? So really, this is where it began for us in Medicine Hat with PSH. We had to take a look at what is working and what is definitely not working. All right, so this is the framework that we utilize at Permanent Supportive Housing currently. So it includes structured reflection and active, consistent supervision sessions with frontline and leadership and participants, not supervision, but more so reflection, feedback loops, and professional development workshops. So really, this just creates an environment where continuous improvement is encouraged and systematically supported. So the clarity and quality of our reflective processes absolutely equal to our actionable improvements. And our team and participants of our programs provide incredibly invaluable ideas that positively impact service delivery. So one thing to note is that this isn't an approach that can be done independently, and it requires practitioners at all levels and not folks just within your program, but within your agency. And it has a conceptual, organizational, and individual level of impact. I do want to note, though, that like any other practice, reflective practice also has its limitations. If we aren't attuned to our own self-awareness of our own biases, and we don't have that own introspection around our own practices, it will absolutely affect our desired outcomes because they will be affected by our biases and personal values and beliefs. So just really important to keep that in mind as well. All right, so I wanted to touch specifically on the improved outcomes that we are seeing as a result of implementing more reflective practices within our PSH program. So again, regular reflection and supervision sessions create a culture where staff were empowered to have more creativity in problem solving and in the development of new strategies. So instead of leaving change at a leadership level, we absolutely engage with our frontline team. For example, there was purposeful team meetings around enhancing service delivery, which resulted in increased community partnerships. There was a significant increase in stability in our on-site occupancy rates, an increased number of graduates from the PSH program, enhanced landlord program relationships, and successful long-term placement for folks who are needing increased daily living supports. Direct leadership involvement in gaining participant feedback was also very important. Myself and the program supervisor do something quarterly called Munchies with Management, where we literally just go door to door and we just engage with the folks and we say, how are you doing? How are things going with your case manager? What are you liking? What are you not liking? And as a result, we also implemented and created a participant survey, which in the history of our PSH program in Medicine Hat hadn't been done. So giving the participants an opportunity to provide that written feedback as well was really phenomenal. There we had enhanced client outcomes, so staff have become more attuned to the needs and preferences of our participants, so personalized support plans, so really specific, unique parenting support plans that are based on the needs of that participant and their child directly, so that if they're connected to PSH, it's not an automatic, oh, you won't have visitation with your kiddos. It's okay. How can we make it safe for you and your kiddo and your community? Having pet safety plans as well, so that if something happened to you, what happens with your pet? Who's going to take care of them? What's your contingency plan? Which led to overall higher levels of client satisfaction and stability. We also experienced increased community collaboration. So we have smart recovery meetings on site. We have enhanced and increased the frequency of our community events. We've addressed system gaps outside of program in partnership with outside agencies. And finally, this has really put us in a position that where we can actually begin working with our First Nations, Métis, and Inuit community to enhance our practices and again, be a participant in Truth and Reconciliation. So this means individual work with our local elders in our community, partnerships with some local agencies, and it's allowed us to be self-aware as a program of the importance of decolonizing practice in the moment, and ensures that we're consistently working toward reconciliation efforts as well. Next, our improved outcomes include some better outcomes with staffing. And so because of the improved outcomes as per our contract, we were granted the addition of a fourth case manager, which increased our capacity for scattered site. We had an increase in staffing stability. And I know this number might seem like nothing, but over 70% of our PSH team has actually been there for over a year. And having been there for about 5 years myself, that I can't remember the last time I had a team that was super consistent. And the full-time especially. So about 50% of our full-time team has been there 3+ years at PSH, which is great. Next, a decrease in emergencies. So when I came back to McMan and stepped into the leadership role, the level of opiate-related emergencies that were occurring on site were beyond the norm that I had seen before. Because of that, I knew it was something we needed to address, but I didn't want to implement anything that wasn't trauma-informed for the participants or the staff, or ones that didn't promote housing stability, like really stringent guest management policies. And I also didn't want to take a leadership approach that reflected micromanagement, because that is just not reflective of the leadership style I have. What I did do was acknowledge the concerns directly and allow to put everything on the table, as hard as that might have been. So we acknowledged the staff trauma, the amount of participant grief and loss and staff grief and loss, the amount of burnout, the significant number of turnover that we were experiencing on our team, and the negative impact that this was having on service delivery and our presence in the community. So when this was on the table, I just asked my team, starting with the team, what is actually needed here? And what are the things that you need for yourself? And what needs to change for yourself and our participants? So through reflective practice and a lot of meaningful team discussions and meetings, staff was really wanting something that was more preventative and recovery oriented. So we went ahead, this was after some time, but we partnered with Brave Buttons, which is, I'm not sure if any folks are familiar with Brave Buttons in the room. They're an agency based out of Vancouver, BC, that actually specialize in overdose prevention. And so in every single unit on site, we have something that looks very similar to a doorbell. And really it's for participants to use if they need a check-in, if they've used substances, or if they're in a significant opiate-related emergency, that they press it twice and support will come right from the get-go. It's very interesting because prior to this, the only thing for our staff to do in the event of an opiate-related emergency was wait for somebody to really come running to the door. And because we're 4 floors, it's hard. And so one of the biggest pieces of feedback was from the staff was, it's so amazing that I don't have to watch somebody on camera run down our stairs thinking that I'm going to have to respond to an overdose. And so with these buttons, we have utilized them for opiate poisoning responses, but it also gives our participants a way to actually reach out for support related to guest management concerns. If they have a guest that potentially is just displaying some violent or threatening behavior, if there is an altercation in the unit, we actually, about 75% of the times the buttons have been pressed for staff support are non-related to opiate emergencies. And so when they have been, staff know exactly which unit they're in, and they're able to attend with an opiate response kit as well as the AED and prevent on-site fatal poisonings. We do have the instance of somebody asking to use the phone or if their laundry's done, and staff usually run upstairs to answer them. But besides those, the implementation of the Brave Buttons has been phenomenal and has absolutely created like a sense of safety in their home. So again, relating back to preventative recovery approaches, which is the Brave Buttons, and this supported our significant reduction in opiate-related incidences as well. And sorry, going back to this one. So from August 2023 to August 2024 of this year, we had a 45% decrease in opiate-related emergencies on site, and 83% of the emergencies that did occur were actually non-participant related. And so staff were actually responding to either guests of our participants or folks who were in the area around our property that did need intervention in the moment. All right, so again, August 2023, operating status quo, few service delivery developments since the initial startup and then the change in leadership. So a few months in, we started the implementation of reflective practices, so a lot of that supervision reflection sessions. By January 2024, we had the addition of a 4th intensive case manager with an expansion of scattered site supports. By May of this year, we increased our partnerships with consulting agencies like OrCode for outside perspectives so that we could see what was really happening and not just from our perspective. By July of this year, we continued our community collaboration with a focus on truth and reconciliation efforts within our program, which leads us to today, where we're continuing our reflective practices. So some key takeaways. True reflective practice is knowledge and transparency always with your team where you can. Again, it reminds us of why we're practicing the way we are in the moment. It allows us to move away from crisis management and makes way for a more therapeutic and planned approach. And it allows staff and ourselves to self-manage emotions and behaviors in response to triggering events. Reminds us what we're about when we act in the moment. It enables self-care and participant care, and it facilitates safe and compassionate practices. Again, reflective practice does need a leader to start. So who would this be in your organization or on your team? Does your leadership style reflect this? What is your leadership style? So a couple of stats, program utilization. So this is current until September. So our first 2 quarters of this funding year. So one of our buildings had an 8% increase in occupancy rate. Our second building had a 44% increase in occupancy rate compared to last year. And so both of those are in the low 90s for stable occupancy rate. And our scattered site participants experienced a 20% increase in stability for housing stability compared to last year. The average number of participants on our caseload is sitting at about 40, with 5 participant exits from program this year, which were all considered successful. For program outcomes, at intake and 3-month follow-up assessment, we had a 100% decrease in number of days hospitalized, number of times at the ER, and number of days incarcerated. And because these are averages, the numbers are a little wonky, but again, decreased our percentages or amount of police interactions and court appearances by over 50%. So again, just trusting the process. This implementation of reflective practice absolutely takes time. It doesn't happen overnight. It's all about balanced perspectives, focus on continuous improvement and structured reflection. And it does take a collaborative approach. So it does seem easy in theory, but ask yourself this. How long has your program and your practices been staying status quo? Why are your practices the ones you utilize today? And have you created a culture that fosters staff curiosity and innovation? The idea of reflective practice is really to remind staff of their why and hopefully bring you back to your why. Why is it that you do the work that you do? And what are the reasons that you're doing this work? Only then can you answer that question. So thank you. Some contact information if you need, but if anybody wants it, I will have business cards at the end of the presentation too. So thank you.
Thank you, Dani. So we're going to have our second presentation, and then there'll be time for questions to both presenters. So I'm pleased to introduce Melissa Perri. Melissa is a PhD candidate at the Dalla Lana School of Public Health at the University of Toronto, and she's also a research coordinator at MAP Centre for Urban Health Solutions at St. Michael's Hospital in Toronto. So Melissa.
Okay, hi everyone. Thank you very much for coming today. My presentation is going to take a little bit of a different approach than Dani's did. I'm going to be approaching this topic from a bit more of a theoretical stance and going to speak a bit about how we can better consider gender in housing first. So as Stephen said, my name is Melissa Perri, and I am very happy and very honored to be here presenting in this particular session today and to be a recipient of the Paula Goering Award. I hope that one day my work can be as influential as Paula's is. Now, before getting started, I did want to complete a bit of a land acknowledgement, acknowledging my position as a settler on the lands on which I live, work, and play, which are known to be the traditional lands of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River. And I also wanted to acknowledge the lands on which we are all gathered here today, which are the traditional lands of the Anishinaabe and Haudenosaunee peoples. I'd really love to leave you all with 3 key messages at the end of my presentation today. The first is that women experience housing insecurity and homelessness differently than cis men. This includes pathways into experiences of housing insecurity and homelessness, the unique dimensions of navigating day-to-day experiences when facing homelessness or housing insecurity, and also the processes for exiting homelessness or housing insecurity. The second key message is really that we need more research that examines comprehensively the housing experiences of women specifically. Given the fact that women experience housing insecurity and homelessness differently than cis men, our existing ways of measuring data and capturing those experiences are not entirely effective. And lastly, speaking specifically to Housing First, acknowledging that there is an opportunity to improve existing practices if gender transformative ideologies are incorporated in the development, implementation, and evaluation of these programs. Before getting into the details of these key messages, I did want to lay some groundwork for my presentation today and speak a bit about the existing housing system and what position I'm coming to this work from. So many scholars argue that the existing Canadian housing system is gendered due to the gendered structuring of society. And I'm going to be referring to this phrase, gendered structuring of society, throughout my presentation today. And what I really mean by that is it's the way in which gender is deeply rooted in systems, values, expectations, and interactions that occur across society. When we consider this gendered structuring of society, we're viewing gender as something more than an aspect of an individual's identity, but something that is actually imposed on them and influenced by dominant power relations, which in this particular circumstance is patriarchy, and how this power relation works to oppress women specifically because of their gender. When thinking about this gendered structuring of society in the housing system, we can see that it influences how women navigate housing systems, how they attain housing, if they're able to maintain housing, and whether or not they have access to appropriate and safe housing supports and services. Patriarchy's influence on social programming is quite vast. And I'm going to be talking about a bit of the implications today, but I'm only going to be talking about one piece of the pie. One of the frameworks that I like to use in my program of research is the one that you see on the screen here, and it's adapted from the work of the BC Centers for Women's Excellence. We can use this framework to map how programs consider or don't consider gender and determine the implications of that. So if we were to look on the screen here, we can see on the right side of the screen, in the gender absent space, programs that take up a gender unequal or gender blind approach to programming actually perpetuate gender inequalities and exploit individuals. On the opposite side of the spectrum, in the gender aware space, we see if programs take up a gender transformative approach to care, they work to address the causes of gender-based health inequalities and transform harmful gender roles, norms, and relations. Gender transformative programming actually works to redistribute resources in ways that center women and are trauma and violence informed. But before getting too into this framework and applying it to Housing First, I want to get back to some of the key messages that I mentioned at the onset of my presentation. The first being that women experience housing insecurity and homelessness differently than cis men. So one of the main differences is actually pathways into homelessness for women when compared to cis men. And the main driver of homelessness for these groups is actually exposure to violence. This can be exposure to violence as children, as youth, navigating family violence. It can include being exposed to violence early on and as young adults, or being continuously exposed to violence through intimate partner relationships that are characterized by violence. This relationship between violence and exposure to homelessness has been very well established in research to date. In fact, a few years ago, the Pan-Canadian Women's Housing and Homelessness Survey that was conducted by Dr. Caitlin Schwann and colleagues found that among 500 women and gender diverse people who participated in the survey, 75% actually identified as a survivor of trauma or abuse. These findings are time and time again, reinforced by literature that has identified that both physical and sexual violence is the main causes of women's experiences of homelessness. Now, unfortunately, exposure to violence is not only a main precursor to the pathways into homelessness, but actually characterizes women's day-to-day experiences when navigating housing insecurity and homelessness. As we can see here, there are unique gender dimensions of housing insecurity for women specifically. These dimensions that you see here on the screen were actually shared with me from women who were experiencing housing insecurity residing in Kitchener-Waterloo, Ontario. When I asked them what it meant to be a woman and to experience housing insecurity, this is the consistent themes that they shared with me. They discussed the continual exposure to intimate and community violence and how this facilitated ongoing experiences of trauma, pain, and anxiety. They continually discuss that women have their bodies sexualized and exploited by community members, peers, and even members of the public when attempting to access shelter, drugs, or food. And they also discussed that the lack of safe and gender-responsive housing forced them to navigate situations of withdrawal, residing in unhygienic living conditions, or residing in unsafe environments with men. And unfortunately, this last notion about the lack of gender-responsive housing conditions is something that we see in communities all over Canada, not just in Kitchener-Waterloo, Ontario. So we can see here from this quote shared by Alice, really what it meant for her to experience homelessness. At the time of the interview, Alice was residing in an encampment, and she had reflected that her experience is unfortunately not unique. She shared that residing in an encampment for women meant navigating consistent exposure to violence, both violence directed at women, but also exposure to violence in the community. In just 1 month, she had gone through 3 tents because 2 had been cut up by people trying to get at her, and the last one was lit on fire because the community member thought that she was in it, but she wasn't. She explained that navigating consistent exposure to housing insecurity and homelessness also included navigating consistent exposure to trauma, anxiety, and instability. Now, if I were to jump back to what I mentioned earlier about the gendered structuring of society, we can really see how, because of this, most of the policies and programs that we see in Canada right now relating to housing operate in that gender absent section of the framework. It's not only programs that operate in this way, but a lot of the research that we have to date in the housing space also operates under this gender absent view. A quick review that was conducted by myself and a colleague, Dr. Patricia Ocampo, found that between 2017 and 2021, only 3% of publications that spoke to housing interventions actually used a gender-specific or transformative approach to housing. Now, although we're seeing a shift in the last few years of considering gender in this space, much more work is needed to comprehensively understand the experiences and then inform interventions based on gender. A really common intervention that we can see and use as an example that falls along the right side of the continuum is actually single room accommodations. So single room accommodations are seen in a variety of communities across the country. They're tailored to different settings, but they're pretty much the same if you look at the shells or the bones of the different programs. They provide acute housing support to individuals in need, oftentimes in a building. They're known to be mixed gender spaces and have reported to be overcrowded, unsafe, and have limited access to wraparound services. So it's really the provision of housing. Work that comes out of British Columbia that's actually evaluated single room accommodations from the perspective of women have found that when they access single room accommodations, they are uniquely exposed to physical and sexual violence, harassment, and stigmatization. If we were to move to the left of the gender-informed continuum and implement single room accommodations in a gender transformative manner, services would look very different. We would provide services beyond housing and take a wraparound approach to care. There would be women-only spaces, so where women can stay and also be given opportunities to bring their children or stay with their children. Services would be delivered using a trauma and violence-informed manner. There would be unique considerations for safety, and there would also be unique considerations for location. Are accommodations near services, near schools, near employment opportunities? And lastly, there would be unique consideration for provider surveillance. One of the main findings in research to date is that a lot of the harm and distrust that come from single room accommodations from women is actually the immense amount of provider surveillance that is found in these spaces. Thinking about things like cameras, random check-ins, and so on and so forth. So being mindful how we kind of implement this in practice. So a lot of these principles and perspectives also apply to Housing First. But before getting into that, I want to take a moment to go over the Housing First theory of change. So for folks in this room who are familiar with Housing First, a lot of these domains may not seem new to you, but I'll take a moment just to kind of work through them and think through how this could potentially apply to gender. So the domains that we see in this chart were actually taken from the work of Ocampo and colleagues, and they do a really great job in this paper of walking us through the different domains of change and how they interact directly or indirectly and lead to the three main outcomes, which are improvement of quality of life, improvement in recovery relating to mental health and addiction, and reduction in crisis-related events. So just for folks who may not be familiar, if we were to look at the 0 to 6-month mark, we can see that domains of change include access to public benefits, whether individuals have improved perceptions of their working alliance with their case managers. Do they trust their case managers? How is that relationship working? Do they have constant communication? Are clients entering the program with an aspiration for change? Do they have motivation for change? Do they believe that they can change? Are they able to access health and social service consultations that they need or require? What are their perceptions on their subjective well-being? Does that change over time, and how so? And then whether or not they are participating in meaningful activities. Now, each of these domains evolve and interact with each other as clients move throughout the program, but ultimately, if everything was to fit into place, the three outcomes that I mentioned were to be achieved. This is a really nice diagram that is included in the paper that I mentioned. And this kind of provides a nice overview of how this theory of change can kind of work or not work. So we can see here that the solid red lines are direct relationships, and then the checkered lines are indirect relationships. So if we were to pull apart one of the pathways here, let's say the top one, we can see how improved access to public benefits, such as income, for example, directly relates to individuals' sense of subjective well-being, right? You have increased access to income, you're able to improve your stability, your sense of well-being improves, which directly relates to an improvement in your quality of life. It's a very simple, kind of straightforward theory of change, which we often see in Housing First research and program development. But if we were to, again, go back to the gendered structuring of society, we know that social programming doesn't always work like this because of patriarchy's influence. Due to this, for women, this pathway is not always linear and is not always direct and is actually influenced by many contextual factors. So thinking about things like navigating violence, safety concerns, past exposure to trauma, relationship constraints, and even issues relating to individual sense of identity, which influences their subjective well-being. Due to this, we can kind of place Housing First programs somewhere in the middle of the gender-informed continuum. And I will say with the caveat that not all programs are the same. Certain programs are tailored, provide unique considerations for different elements that hit the gender-informed continuum. So I don't want to say that all Housing First programs sit right in the middle or sit all the way to the left or all the way to the right. But if we were to generalize, the majority of Housing First programs fit somewhere between gender-sensitive or gender-specific. And we actually have research that supports that. So if we were to draw on evaluations of Housing First programming that spoke to the findings of women specifically, so that's speaking to women alone and not speaking to a variety of individuals and mixed genders, but just speaking to women alone and asking them, how are your experiences with this Housing First program? What's working and what's not working? This is what's been found. So beyond the positive outcomes, research has also shown that women feel as though they have a lack of autonomy as they engage in Housing First programming. There are concerns surrounding speaking up if women don't particularly like housing spaces or housing environments or neighborhoods. They feel as though they have an inability to really control decisions because they felt as though case managers kind of take the lead in conversations with landlords or even conversation with banks and so on and so forth. So they kind of have reported a sense of limited autonomy when engaging in Housing First programming. Similarly speaking, women have reflected that they feel as though after engaging with Housing First programming, they have had a lack of comprehensive support provided. So beyond the supports relating to housing, mental health, and addiction, women have shared that they'd like other supports, wraparound supports that they can take away with them that would help with the longevity of their stability. So thinking about things like building skills, getting training, helping women go back to school, determine unique needs or unique ways to improve their economic stability, and so on and so forth. Women have also shared that there have been concerns regarding safety as they've engaged in Housing First programming, thinking about where they're living, what the spaces look like, who they're living beside if they were housed in apartment buildings. Because of that first point there and the limited sense of control over decisions, women felt as though they were choosing between being unsafe in their Housing First accommodation or being unsafe in other housing supports that they were in. And because of these 3 points, women have also said that there have been challenges to gaining a comprehensive sense of stability. They've moved into housing programs, housing accommodations, but because of the fact that they felt limited control over their decision or unsafe in their spaces or at a bit of an odds with respect to what's next for them, they have reported having a lack of sense of stability, a lack of comprehensive social networking, and a lack of community. So what does that tell us? That tells us that there are opportunities to move along the continuum and further the reach of Housing First programming. If we were to apply this framework to Housing First and say that we were to apply these programs using a gender transformative lens, services would look very different. Similar to the analysis that I presented a few moments ago relating to single room accommodations, we would see services within Housing First programming prioritize education and the economic security of women, thinking about things like training, improving financial literacy, those tangible skills that they've asked for. It would also include peers as part of program development. Work that I conducted with Kathy Watts and Petra Babik of peer-to-peer consultants actually showed that women who have faced intimate partner violence or are facing intimate partner violence prefer having peers as part of program relating to shelter access, mental health supports, in addition to substance use, just due to distrust of service providers in different communities. So having peers as part of Housing First programming, supporting women through accessing housing, speaking to landlords, and so on and so forth will further the gender transformative reach of these programming. Housing First programming should take on trauma and violence informed care. And I'll say that with a caveat that a lot of Housing First programs do, as we heard about 20 minutes ago, but a lot of them don't. A lot of practitioners kind of don't understand the comprehensiveness of trauma and violence informed care, what that means for service delivery, how that fits in all the different elements of Housing First. In addition to that, staff would be trained to support those who are facing or who have faced violence. As I mentioned early on in my presentation, Violence is so concrete to the experiences of housing insecurity and homelessness for women. Having staff that are trained and understand the dynamics relating to violence would further the reach and make Housing First programs gender transformative in nature. Like I mentioned, they would consider safety beyond ensuring that women have an accommodation. Considering safety would mean considering who women would be living next to, what the environment looks like. Is it a building? Is it a home? Where is the neighborhood? What does that look like? Are there any trigger points for them if they've experienced violence in the past, and so on and so forth? These programs would consider the location. Are they close to employment opportunities? Are there near services? Are they near schools? And lastly, they would offer comprehensive support to allow women to reconnect with family, children, or friends. Now, the way that I've just framed it seems as though I think it's easy to do all of this. I know it's not, right? And there are resource constraints, and there are a variety of different barriers on a structural level that inhibits a lot of programs from taking on this perspective. But there are small things that we can do to begin to move along that continuum, not necessarily moving from gender unaware to gender transformative overnight, but there are small incremental changes that we can make on a program level to begin to move towards that left side of the continuum. First and foremost is education. A lot of conversations that I've had with folks in the community, they're not familiar with gender transformation. They're aware of gender in their programs, but they don't really do much because they don't know what to do. So having conversations about what gender transformation is, how that could look, providing examples, working with program staff and leadership to think through implementing gender transformation in their work. In addition to that, providing comprehensive education about trauma and violence-informed services. Like I mentioned, a lot of programs take this on, but a lot of programs don't do it in the quote unquote correct or comprehensive way. So having education about that. And another large part of it is just staff reflections. So thinking through a framework like the one that I presented and having staff reflect where along the continuum do all of our different services lie. Is 5 out of the 10 services in the middle and one's at the very end? And where do we lie, and how can we kind of work with what we have to move our way, and what do we need to continue to move our way down the continuum? A large part of it, like I mentioned in my key messages, is that we need more research that is gender transformative in nature. We need more work and more data that is coming from the position of gender transformation, to be asking the right questions, to be speaking to the right people, which ultimately will help inform housing interventions moving forward. So in summary, I think I've hammered this point in. There's a need to move away from gender absent and gender sensitive services to really establish services that are gender transformative. Housing First has had tremendous success, but there are opportunities to further its reach and to really improve outcomes for women specifically. Thank you very much again. If you have any questions or would like to connect, please feel free to shoot me an email.